The following segment is sponsored by United Healthcare. A recent survey found that over 1/3 of Americans spend less than 1 hour per year reviewing their health benefit options. With the annual enrollment season upon us, now is the time to assess your coverage and find the plan that works best for you and your budget. Joining us now to discuss is the Chief Medical Officer at United Healthcare, employer and individual doctor Rhonda Randall. Great to see you, doctor. Thank you for joining us today.
Thank you for having me.
Absolutely. Okay, well, what should people be thinking about as open enrollment gets underway this year?
Well, this is a time of year that millions of Americans need to make an important decision. About half of us get our coverage through an employer-sponsored plan. So they're sending you an email sometime between now and the next few weeks, letting you know that you have usually a 2 to 3 week period to make that decision for your health benefits for next year. And if you're a Medicare beneficiary, your annual open enrollment period starts on October the 7th and will close on starts on October the 15th and will close on December the 7th.
Okay, so make sure to be aware of that window. It's so important. Dr. Randall, what are some tips that can really help people pick the right specific health plan for next year?
Well, you don't want to wait to the last minute. So let's change that so that more people are really taking a little bit of time. This is an important decision. It affects your health and it also affects your financial well-being. So you want to give it the due time it deserves and get educated about the plans that you have offered for next year. You may be very happy with the plan that you currently have, but there could be changes in that plan. And there may be a new plan available to you that you haven't considered before that could be a better fit for you and your family.
Sure, certainly important things to think about. All right, and speaking of which, cost is top of mind for so many people these days. Do you have any additional tips to really help people find a plan that works for their budget?
Yeah, start with seeing if your own doctor is in the network. That can really help you lower your out-of-pocket costs. You'll also want to see if you take a prescription medication, if that's covered by the plan, and make sure that it hasn't changed from year to year. There can be changes there as well. You're going to want to look for other benefits and services that can help lower your costs. Things like vision, dental, and hearing. Wellness benefits that can give you rewards or incentives for making good choices. And things like mental health and virtual visits. All of these things can help lower your out-of-pocket costs and give you access to more healthcare services. So you're going to want to do good research to understand the differences between the offerings available to you.
Sure. Those couple minutes of research are really worth it because you end up saving a lot of money. Thank you so much for these tips. Where can we go for more information?
You can go to our website. We have all this information and lots more. It's uhcopenenrollment.com.
All right. Thank you so much, Dr. Randall. Great to see you. We really appreciate it.
Thank you. Be well.